Canadian doctors have been warning about the impact of a new American policy slashing the number of vaccines recommended to children. They say the consequences could be deadly. Health law professor Tim Caulfield joins us this morning for more on this conversation. So first of all, Tim, can you kind of give us an overview of what exactly is happening with vaccine recommendations in the U.S.?
You know, I don't think it's over the top to say it is a complete mess. It's a complete disaster. The RFK Jr. Organization, we'll call it, is making one science-free move after another. He's decreased the number of vaccines recommended for children. He's attacked Hep B vaccinations. And now it looks like they're going after COVID vaccines. There's no evidence to support any of it, and it creates real harm. In fact, we're going to have, this is such an important topic, Kent. I've got props this morning. We see vaccination hesitancy going up, and I really think it's just an increase in doubt mongering. It's just creating confusion, which is making it more difficult for people to make decisions. But it is having an impact on perceptions. Look at this study. This was a recent study done in the United States, and they found that only 32% of Americans think that the COVID vaccine is generally safe. A very modest question, generally safe. And something like 50% aren't sure. So that is doubt mongering having a horrendous impact.
So what kind of myths are fueling this? Or what kind of information is casting this doubt for people?
So there's so much misinformation about virtually every vaccine out there. And the bottom line is there's so much research on these vaccines. They're safe and effective. But let's zero in on the COVID vaccine just for a moment. I know it's everyone's favorite topic, so I thought I would pick that. But the kind of myths that you're seeing is it causes turbo cancer. No. That it increases sudden death. No evidence to support that. That has impact fertility. And the big one, I think, is somehow that, and this is really pushed by RFK Jr., that somehow it hasn't been studied. Like the idea of safety is a new idea. That's just so wrong. There is a very large and robust body of evidence using diverse methods that tells us these vaccines are safe. And again, there was a big study out of France, over 20 million people involved. Yes, it's an observational study, but the data is still really impressive. And they found those that got the COVID vaccine, look at that conclusion, vaccinated people consistently had lower risk of death, of all death. Right? Yes, we have to be careful not to overinterpret this, but if there was something seriously wrong with the COVID vaccine, I promise we would know. We would know. All the data points in the exact opposite direction. In fact, we know that you get improved pregnancy outcomes. This is a very recent study from UBC found this. Other studies have found it. You get decrease in hospitalization. That's a very good thing if you take the COVID vaccine, especially with our stress system. And yes, decreased stress. Study after study after study shows this, but the noise that's coming out of the United States is creating confusion and hesitancy, and that is creating real problems.
And really quickly before you go, why should this matter to Canadians?
It does matter to Canadians. The research tells us that this confusion is having an impact on perceptions here in Canada. Kent, all you need to do is create a degree of hesitancy, a degree of doubt, a degree of confusion, and you've got problems. And I'll tell you, the word confusion, I think that summarizes what's going on with RFK Jr. pretty well.
Okay, well, Tim, we always appreciate your insight on this. Thank you so much for joining us this morning. Tim works at the University of Alberta as the author of several books, the latest of which is called The Certainty Illusion, What You Don't Know and Why It Matters. You can follow Tim along on social media as well, at Caulfield Tim. Thank you, Tim.
Thank you.